We're going to go ahead and get started. Welcome, everybody. And I will pass this along to Michelle to get us started.
Thank you, Lisa. Greetings, everyone. Thank you for joining us for our first town hall of 2025 for the Community Support Waiver. I'm going to be turning this over to PCG to talk more about the work that we have been continuing to do so that you can review what we're putting together for the Community Support Waiver. And I'm going to turn this back over to Lisa.
Thank you so much, Michelle. And my name is Lisa Worm, and I, in partnership with KDAD's Public Consulting Group, has joined together, and we are helping to manage the CSW waiver. So we'll talk more about that as well. So again, my name is Lisa, and also with us on the call today is Audrey Davis and Jackie Merriweather and Eliane Sorensen. So we'll all be presenting on different items today. And thank you again. We'll go ahead and get started. So overall, today we'll be just talking about PCG and how we interact with the CSW and as partners with KDADS. We'll just run a brief poll question for those who have joined us before to be familiar so we can get an idea of who's on the call. We'll talk about some updates since our last town hall, and Eliane will go over our quality improvement strategy, and I will be discussing how the CSW interacts with other disability service programs. And then Jackie will go into more detail about how the CSW will interact with state plan services. And then we will wrap up after that. So that is our agenda for today. And I am going to hand it back to Audrey.
Thanks, Lisa. Hi, everyone. My name is Audrey Davis, and I am a member of the stakeholder engagement team at PCG, and I'm going to review the goals of the CSW as well as Public Consulting Group's role in this project. The Community Support Waiver, or the CSW, is a new Medicaid waiver that PCG and KDADS are developing alongside feedback that you, the stakeholders, provide. This waiver will assist Kansans with intellectual and developmental disabilities, or IDD, who do not need continuous 24-hour support. The CSW is aimed to promote community inclusion and therefore will expand and support community care choices, as well as natural support systems to make it easier for anyone to live independently at home and in their community. Moving on to PCG's role, Public Consulting Group, I think we can go to the next slide. Sorry. Public Consulting Group, or PCG, is a public sector consulting firm that works with state health, education, and human services agencies. We are partnered with the Kansas Department for Aging and Disability Services in order to assist with the developing of the Community Support Waiver, which includes writing and organizing the CSW, designing a plan for implementing the CSW, as well as collecting feedback from stakeholders like yourselves, whether in forums like these town halls, our technical advisory group, or through feedback submitted through our email or our website. So now we're going to launch a poll. If you could go to the next slide. So we're going to launch a poll to get a gauge of the stakeholder engagement groups that you all are a part of. If you could kindly answer the question on your screen, which should ask you what group describes you best.
Just one moment.
So the options for this poll will be community developmental disability organization, a provider, self-advocate, parent or family member, or any other group that you identify with. So you should all be able to access the poll right now. We'll give it maybe about 30 more seconds.
Oh, actually, I see everyone has answered.
Oh,
100% participation. So,
awesome.
for those who can't see the poll on their screen, it looks like our highest attendee are those with provider organizations. So I'm going to go ahead and end the poll.
Great. Thank you, Lisa. If you missed the poll, no worries. This is just an informal poll to see who was able to attend today. But thank you all so much, those who were able to complete this. It's really great to see how many folks were able to join us today from very different stakeholder groups. So that's always great to see. All right, we can move on to the next slide. Okay, so now we're going to go through some updates since our last town hall. So first of all, we have updated the CSW website with a few new resources that will make it easier for you all to access information about the CSW. This includes all updated definitions for proposed CSW services, materials from the December town hall, such as the recording and the slide deck, as well as a new FAQ section that can be downloaded just as a PDF. In addition, there's an updated rate study timeline that we'll be talking about in just a little bit. So we can move on to the next slide. So another update is that based on feedback from providers and the Provider Association, KDADS has agreed to extend the deadline for providers to participate in the rate study. This means that providers will now have until February 28th, 2025 to submit the cost collection and the time study tool. Because of this change, the submission date for the CSW to CMS will now be January 1st, 2026, and the updated implementation date will be shifted from spring 2026 to summer 2026. If you have any questions directly related to the rate study, you can visit the rate study website or send an email to the address on the screen. And now I'll pass over to Elion, who's going to be discussing the quality improvement strategy for the CSW today.
Thank you, Audrey. My name is Elion Sorensen, and like Audrey said, today I will be presenting on the section of our waiver that focuses on the quality improvement strategy, which I will call the QIS. Next slide, please. CMS requires that states develop a quality improvement strategy to measure waiver performance, ensure the waiver meets statutory and regulatory assurances, and identify areas for improvement. For example, one assurance is that service plans are updated at least annually. CMS requires that states describe the policies and processes used to ensure that each participant's service plan is reviewed at least annually. Next slide, please. Throughout the waiver application, CMS asks that states describe 1. The measures and processes that the state uses to determine that each waiver assurance is met. This is referred to as discovery and includes all the evidence-based activities that the state conducts for each of the waiver assurances. And 2, the measures and processes used to correct identified problems. This is referred to as remediation and includes the activities used to correct individual problems identified in the implementation of each of the assurances. Next slide, please. The overall quality improvement strategy is outlined in this section of the waiver, and the QIS that I am going to describe now is the same across all waivers. That means that there aren't really updates for the CSW compared to the other Medicaid waivers for the state. CMS requires that the QIS describe the following information: the system improvement activities followed in response to the analysis of discovery and remediation data collected on each of the assurances, the responsibilities of those assessing and prioritizing system correction and improvements, and this includes how information about performance is used to identify and prioritize areas for system improvement, and the processes that the state uses to assess the effectiveness of both system improvements and the overall QIS and revise it as necessary. Next slide, please. Over the next several slides, I will discuss the quality assurance processes and the responsibilities of those involved. KDHE and KDADS collaborate in developing operating agency priorities to meet HCBS assurances and minimum standards of services and implement the QIS. KDHE delegates monitoring, remediation, and oversight responsibility to KDADS, and KDHE monitors these delegated activities through established committees. KDAD's quality assurance staff collect, aggregate, and analyze data to identify trends, discrepancies, and areas for improvement. Next slide, please. KDAD's quality management specialists, QMS, conduct quality reviews on eligibility assessments and managed care organization records. On a quarterly basis, the KDAD's Financial and Information Services Commission, FISC, identifies a representative sample of HCBS waiver participants and requests that MCOs upload all files for those participants to the quality review tracker within 15 days. Assessing entities, in this case that is CDDOs or their subcontracted entities, must upload all assessment files to the Kansas Assessment Management Information System, KAMIS, which KDAD's QMS also review. Next slide, please. KDAD's QMS review quarterly submissions from MCOs to ensure accuracy and appropriateness of the service plan, health and welfare of waiver participants, adequacy of qualified providers, and financial accuracy in billing. QMS reviews files from CDDOs to ensure accurate information is being obtained and MEFI assessments are being completed correctly and within the appropriate time frame. Next slide. During their review, QMS will forward any issues or concerns they identify related to a specific case or participant to HCBS program managers. QMS will upload their findings to the Quality Review Tracker for remediation by MCOs and assessors. KDAD's FISC provides a report on QMS findings to HCBS program managers and the HCBS Quality Coordinator. The HCBS Quality Coordinator will evaluate data from the quality assurance team to ensure that each performance measure meets federal standards. If it does not meet federal standards, it is remediated as is required by federal law. Next slide, please. KDADs will notify MCOs and assessing entities of any assurances that fall below minimum federal standards. KDADs also notifies providers of each instance of noncompliance with performance measures. Upon notification by KDADs, providers must respond within 10 business days with a detailed plan for the correction or remediation of the issues identified and a timeline for the completion. KDAD's HCBS staff review the remediation plan for approval. They will request a resubmission if the plan is not approved, and they'll monitor the provider for compliance with the approved plan. Next slide, please. I'm now going to talk a little bit about quality improvement efforts. The HCBS Quality Coordinator identifies areas for improvement based on data and analysis provided by the QA team and oversees system improvements and remediation efforts. The Quality Coordinator determines if issues are systemic or isolated and identifies areas for improvement, such as MCO training, remediation plans, revising data collection or reporting protocols, clarifying policies, or having meetings with MCO directors and staff. The Quality Coordinator also meets quarterly with MCOs to address ongoing issues and areas for system improvement, as well as to monitor any ongoing remediation efforts. Next slide, please. Now I'm going to discuss the quality improvement efforts regarding the Kansas Assessment Management Information System, KAMIS. KAMIS is the electronic repository for data about participants and received services. The web-based system stores participant assessment and referral data. Assessing entities, again, that's CDDOs or their subcontractors, upload all assessment data to KAMIS. System changes are made to KAMIS to enhance the availability of information about participants. Improvements to KAMIS are initiated through comments from stakeholders, program managers, and quality review staff. The KDAD's HCBS Quality Coordinator and program managers monitor and evaluate improvements to KAMIS. Next slide, please. I'm now going to just briefly talk a bit about how KDHE monitors and oversees quality assurance processes. KDHE monitors KDAD's quality assurance processes through various committees. These committees are currently known as the CAN Care Steering Committee and the Long-Term Care Committee, but these committees' names and their roles may change a little bit. So I can't share that much more about this side, but I'll add that KDADS compiles a quarterly report containing data for all HCBS performance measures, and results of these reports are reviewed internally by KDADS and KDHE. MCOs and assessing entities will also receive copies of that report. And I believe I can now take questions at the next slide.
Thank you, Elion, for covering the quality improvement plan. So at this point, we will now open things up to questions. You have two options. You can either add your question in the Q&A tab. I know at least one person has done so already, but you can type them out there if you'd like. Or if you prefer to ask your question in person, you can raise your hand, and then one of our hosts will give you the option to unmute. You can go ahead and ask your question. So at this point, I'll throw things open and we'll give you all some time to add your questions either in the Q&A or by raising your hand. Okay, so we at least have one person so far raising their hand and one in the chat. I will start with the person, or people now, person again, raising their hand. So Tom Lang, and again, I'll give a blanket apology now if I mispronounce anyone's names. Obviously, it's not intentional. But Tom Lang, if you'd like to ask your question, you should have the option to unmute now.
Okay, it relates to the HCBS quality coordinator. It looks like, can you hear me?
Yes, yes, Tommy can.
Okay, it looks like that person, if it's one person, has a huge role. And among the slide comments from Elian was that they would identify whether incidents that had been reported or represent a trend or just a single episode. It seems like a huge job. So could you tell us more about that person's role and how big it is, including how many providers are they going to be expected to evaluate to determine trends and so on? It sounds huge. I'm just curious.
Yeah, I'm sure, Elion, you can probably provide, hopefully, an overview, a little bit more about that position. I will say, Tom, I don't know how much of the specifics of methodology we might be able to get into right now, but we will give as much information as we can. So, Elion, if you'd like to jump back in.
Yeah, thanks, Peter, and thanks, Tom, for that question. I agree, it certainly is a big role. The HCBS and the KDAD quality assurance team all work collectively to make sure that they are monitoring issues that come up and looking at trends. So I spoke a little bit about reports that are shared with the quality coordinator, and the role that they play in taking any of the data that's shared by the quality assurance team to track any trends. I think it's possible that KDADS here might have more specifics to share about that role, but I'll just add again that this is part of a broader quality assurance team that works together to evaluate incident reports or issues that are coming up with providers, findings that are maybe shared by the MCOs or the CDDOs, and they are able to aggregate this data and look at it to assess for any patterns or trends.
So, Tom, it's Michelle. I did want to speak to, as far as performance measures go, we do have a team that reviews files from the MCOs quarterly to assure, from the MCOs and our assessing entities, to assure that they are following the guidelines we have set forth for those service plans and for assessing entities. As far as critical incidents, that is covered by another team of people who monitor our air system. And then they review the critical incidents and turn them back to the MCOs to follow up on if they need follow-up. Is that what you're asking, Tom?
Am I still muted?
No, Tom, we can hear you.
Oh, okay. I'm glad I wasn't saying anything else. That's thanks for the response. I was just thinking of this the volume of providers who will be evaluated and the relative number of staff who will be assigned to that because just the remediation has something to do with timeliness and their ability to rely on the state to be timely is challenged, I think.
Right, so we do quarterly polls and those are done. Are you talking about critical incidents or the performance measures?
Well, I assume all of that falls under the HCBS quality coordinator, doesn't it?
No, it actually, no, it doesn't. The quality coordinator is a person that takes that information and builds our reports for CMS. Our 372s and our evidence packages that we need to send to CMS to show that we are following the waiver rules and looking for ways to improve the waiver.
Well, yeah, that answers my question. I appreciate it. Thank you.
There's a lot of people involved, Tom. It's not just one person. You're right, it's a huge task, both ends, for performance measures and for looking at critical incident reports.
Thank you, Tom, for the question. It was appreciated. A couple now in the Q&A. We will turn to those. First, we have one in the chat from Ben Layton. Ben Layton asks, do providers need to be affiliated in a similar manner as they are with the IDD waiver? I will throw this one open to the group. I'm not sure exactly what affiliated means in this context, but if one of my esteemed co-hosts does, I would appreciate any help.
Yeah, I can take that one. Oh, go ahead, Michelle.
I was just gonna say, yes, you do have to affiliate with the CDDOs in your area.
Excellent, thank you. We'll keep going. Another one sort of related to CDDOs, oddly enough. This one's from Jerry Michaud. How do we see the QA review process noted here regarding interface or collaboration with CDDO QA processes? Jerry's curious how CDDO QA works together with this process we're describing. Elian, I'll start with you and then see if you can help me out here first.
Yeah, I'll take a stab at that one, but of course, Kate, feel free to jump in as well. I think this question is also getting at a bit of confusion that Tom identified between the role of the quality assurance processes related to the CMS performance measures and the data we share with CMS versus the sort of adverse incident reporting system. So CDDOs do have their own quality assurance processes as regards monitoring providers and keeping track of trends in adverse incident reports, but that's sort of a different side than what we are talking about right now in terms of the measuring of the meeting of these performance measures, if that makes sense. So the CDDO quality assurance process that I'm familiar with is distinct from the measurement of the performance measures and whether or not Candace is following through with these sort of assurances that are promised to participants.
Thank you, Elian. Question from Colleen Hunter. When will a confirmed list of services be available? So we've provided a proposed list that's currently available on the CSW website, but Colleen's just asking when we will know with complete certainty what services will be included under the CSW. So Colleen, the answer here is probably not until we get the whole way through the process. So later on, as one of the later stages, we submit things to CMS, the Center for, I always forget the order, the Center for Medicaid and Medicare Services. They would then have to approve the CSW before it went into effect. So prior to that, there is a public comment period. At that stage, we'll provide sort of a full summary of the CSW that we're planning to hand over to CMS. But like I said, they have to review everything and they have sort of ultimate say at the very end of the process. So we won't know really until then with 100% certainty what services will fall under the CSW, but we'll certainly let you know which ones we're telling CMS that we would like to be included there. Some of my fellow co-hosts, do any of y'all remember offhand the timeline for that, when that submission is scheduled to go through?
I don't remember the timeline, but I know it should be either early or mid 2026.
Yeah, that sounds right.
So,
So,
or I should say, assuming we get approval. But you could also think of proposed as in we would love your input on any of the service definitions as they currently stand. So they are proposed because we want feedback and to improve them however stakeholders see fit.
yes, thank you, Lisa. I should have said that at the beginning. I will reiterate it now. We're still very much open to feedback. We will be throughout this entire process. So if you want to visit the website, kansascsw.com, you'll find many opportunities there to provide additional feedback. So don't think that it's just restricted to this town hall. We want to hear any and everything y'all have to say, and you can do that through the website at any time. Lisa, this exhausts the questions we have currently. I'm not sure exactly how much time we've earmarked for questions here. I could hold for a little longer, or we can continue moving forward. Well, we at least have one more, so why don't we take care of that
Right.
while we're at it? So a question from an anonymous attendee. Will this look different from previous QA processes for a provider of HCBS services? So,
Yeah,
oh
I
yeah,
can
Elliot,
take that
please.
one.
Yep.
So in terms of the state's quality improvement strategy, which is what I've been presenting on, that is largely, not entirely, the same as it is for the other waivers. The specifics of the quality assurance policies as per like the rules that the process for identifying like individual problems and remediating those, I believe that is also just about the same. But again, today we're talking about the state's overall quality improvement system, and that is the same as for other waivers. There's not a difference.
Thank you, Elliot. Then Lisa, at this point, I will throw it back to you. We can move on and we'll just devote any extra time we have to additional questions at the end.
Great. Thanks, Peter. Thank you, everyone, for your great questions. Okay, and you're welcome if you have any thoughts after we've moved on and you still want to ask a question about the previous section, you're welcome to put that in the Q&A. Okay, so I am going to cover how the CSW interacts with other Medicaid programs. So we did want to just go over this as we've received feedback from folks about how the numerous disability service programs and how they differ and how they might work together. So today we'll be talking just generally about VR, CanCare, STEPS, work, EPSDT, and Working Healthy. So those are all their own special acronyms, but we'll be talking about those in a little bit more detail. So generally speaking, Medicaid is a payer of last resort. And what that means is that it pays for services if there are no other sources of payment available. And what you might have experienced with this is something like VR or vocational rehabilitation. So this is a non-Medicaid dollar program, and the CSWU will be a Medicaid program. So they might offer similar employment services, but a person would receive employment services through whatever VR covers first. And then the CSW would step in and cover the remaining services that they're eligible for. So moving down from Medicaid, then after Medicaid, HCBS waiver programs or home and community-based services waiver programs, then they are the payer of last resort. So again, to put this into context, Medicaid, state plan services, and the CSW might offer similar rehabilitation therapy services. So then the person's Medicaid, state plan benefits would need to cover services first. Once those are exhausted, then the CSW would cover any additional services you might need. And as you may be aware, Kansas Medicaid program is called CanCare. So to explain that further, CanCare also includes, or I should say, these services under CanCare are state plan services. That's where EPSDT might come in. Working Healthy, and underneath that includes STEPS and work, and then HCBS waiver programs. So again, these are how they all interact together. To provide a little bit more detail on what we mean when we say Medicaid state plan, it is an agreement between the state and federal government, and it will describe how the state administers its Medicaid program and what services they will cover. So while federal law dictates a certain set of services, states also have the flexibility to cover additional services. And to talk about EPSDT, which you may know as Can Be Healthy. So that's considered a subset of state plan services, specifically for children ages 20 and under. So EPSDT, or Can Be Healthy, it will include all Medicaid services available to adults, plus additional services. And some non-covered services if they're medically necessary. So that could include something like developmental screenings or lead hazard assessments. So to dive into Working Healthy, it is a CanCare program that allows people with disabilities to maintain their Medicaid or state plan benefits, enabling people to earn more income without putting their Medicaid benefits in jeopardy. So you can see that income level for eligibility is at or below 300% of the federal poverty level. It's represented here on the screen by FPL. And then the asset limit, or how much money you can have, for Working Healthy is $15,000, and that's compared to $2,000 normally. So Working Healthy, in combination with either STEPS or work, can provide additional services such as transportation or benefits counseling. So these are some of the great additional services that Kansas offers for folks. Okay, so we've reviewed the Medicaid programs, and now we're going to talk about Medicaid waiver programs, HCBS programs. So these expand the services beyond what a person would receive through state plan. And this, of course, helps folks live at home or in the community rather than an institutional setting, which is always the goal. And the thing that's important to know is that people cannot participate in Working Healthy, in a Working Healthy program, in an HCBS waiver program at the same time. So we're not allowed to duplicate services, so that's why there can't be an overlap. But people have the choice and ability to choose which program fits their needs the best. So this multitude of options will give people better choice, and especially with the CSW. And I know we've covered a little bit of this, and then I'm going to pass it off to my colleague Jackie so she can talk in more detail. And then we'll have some questions.
Great. Thanks, Lisa. All right, so I'm going to go a little more in depth about how the CSW and the state plan benefits interact. So I'll have you go to the next slide, Lisa. All right, so this is a question that we've gotten multiple times. So we just wanted to address it for everybody. If I join the CSW, will I still have access to my state plan benefits? The answer to that is yes. Individuals maintain their state plan benefits while participating in the CSW. CSW services supplement what isn't already covered by the state plan. So when there are similar services offered by the state plan and the CSW will then be the payer of last resort, meaning that the CSW will only cover services not already available to the individual through the state plan. Now, this is something that CMS, that we talked about before, that federal agency that oversees states' Medicaid programs, they want to ensure that there isn't duplication of services and folks are always getting services from the state plan to the greatest extent available. This is especially important for us to pay attention to when implementing the CSW because of the CSW's budget cap. So state plan services will not come out of the individual CSW budget. So we want to maximize their use of those state plan services available to them before using a CSW service, which will come out of their budget. Next slide. This slide here is just a reminder of what services are proposed to be covered by the CSW. I'm going to go more in depth about each of these in the next slide. So I think we can go ahead and move on, Lisa. All right, so this is some information on state plan services. State plan services require medical necessity, and some have limits in place on the scope, frequency, and duration an individual can receive the service. And state plan services also must abide by the purpose of the service. And as we mentioned before, Lisa talked about EPSDT. So Medicaid eligible children aged 20 and under have access to all medically necessary services through EPSDT. The limits on duration or frequency of state plan services that we might see for adults don't apply to children through EPSDT. And then any service that is medically necessary will be covered for the duration in which it's medically necessary for those Medicaid eligible children. Next slide. Okay, so when state plan services are exhausted, a person can access a service through the CSW if that service is identified in the person's service plan. I am going to go through in these next slides each of the proposed CSW services and show you what coverage for the service exists in the state plan for adults or for children through EPSDT. So this is meant as a general overview, but I'm sure as many of you are aware that there are a lot of nuances with Medicaid eligibility and service coverage. So if you have questions specifically related to your eligibility, or if a service is covered for you, please explore those with a CanCare representative. This will just be a general overview. So the list of services you see on your screen here are the services on the CSW that allow for employer authority. That means that someone self-directing their services can choose to hire and be the employer of the provider delivering the service. So we'll start with personal care services. Those are not covered for adults via state plan services. They can be covered under EPSDT if they're medically necessary for the child. And then you'll see that the CSW covers personal care services once state plan or the EPSDT allowance is exhausted. So for example, say we have a 12-year-old participating in the CSW and they need personal care services. If the personal care services are deemed medically necessary, then EPSDT will cover those services, and the participant would not have these services billed out from their CSW budget. Another example, say there's a 30-year-old participating in the CSW and they need personal care services. These wouldn't be available to them through the state plan services for adults. So in that case, the CSW would cover the personal care services to the extent identified in the individual service plan and within our broader $20,000 per person budget cap on the CSW. The next service there, family caregiver support and training, that is not covered by state plan services for adults or under EPSDT for children, but it can be covered by the CSW. Respite is also not covered by the state plan services for adults or through EPSDT services, but it can be covered by the CSW. Non-medical transportation is not covered by state plan services for adults. So the state plan will cover like medical transportation and non-emergent medical transportation. So the transportation to like a doctor's office or like emergency transportation, like an ambulance. But as far as non-medical transportation, this would mean maybe transporting someone to their work or to a grocery store to shop for food. That's all non-medical transportation, and that's typically not covered by the state plan. There are specific instances in which EPSDT could cover transportation to and from school if it's necessary to receive another Medicaid service, but it's typically not covered under EPSDT either. And then as far as the CSW, it would be covered to the extent identified in the individual service plan and within that $20,000 budget limit. Next slide. So therapy services are where we see the most coordination needed between state plan and CSW services. Behavior therapy services are typically not covered for adults through the state plan, but are covered for children through EPSDT. I included some of the names of the services that are available for children that fall within the umbrella of behavior therapy. So that's positive behavior supports, cognitive behavioral intervention, intensive individual supports, and consultative clinical and therapeutic services. The CSW would only cover behavior therapy once state plan or EPSDT allowance is exhausted. And for physical therapy and then occupational and speech therapy, I think you are on that next slide. Those are all covered for adults on the state plan for rehabilitative purposes, meaning they are covered post-injury or illness to restore functioning. State plan services will only cover PT, OT, and speech therapy for 6 months post-injury or illness. Children don't have these same restrictions as adults. EPSDT will cover any amount of PT, OT, or speech therapy, whether it's habilitative or rehabilitative, so long as it's medically necessary. The CSW can cover needed habilitative or rehabilitative PT, OT, or speech therapy once state plan or EPSDT allowance has been exhausted. So for an example, A 30-year-old CSW participant who needs 1 month of physical therapy after an injury, they could get that covered via their state plan services. But if you had a 30-year-old CSW participant who needs habilitative physical therapy to help increase their mobility and independence, and it's not the result of an injury or illness, those physical therapy services could be covered by the CSW, as they likely would not be approved through the state plan. Next slide. So these are the employment services proposed for the CSW. They include life skills, individual employment supports, benefits planning, and career exploration and planning. None of these services are covered through the state plan or through EPSDT. They would be covered under the CSW in accordance with the amount of support needed specified in the individual service plan. Next slide. These are some of the vendor services that are proposed for the CSW: home and environmental modifications, vehicle modifications, and individual directed goods and services are not covered by the state plan, but could be covered by the CSW. I do want to note there's a $10,000 lifetime limit on assistive services, which was established by the Kansas legislature. So this $10,000 limit includes both home modifications and vehicle modifications. Individual directed goods and services, those are only covered for individuals who are self-directing their services with budget authority. Go back, yeah, great. And then as a refresher, individual directed goods and services allow a participant to get needed items or services that aren't otherwise covered by the CSW. So for example, this service might be able to cover like the purchase of a microwave for a participant who needs it in order to prepare meals independently. And go ahead to move to the next slide. So these are the other two vendor services: assistive technology and specialized medical equipment and supplies. So state plan services for adults and EPSDT will cover certain items under durable medical equipment that would be considered assistive technology so long as they are medically necessary. For example, the state plan services for adults and EPSDT could cover an augmented communication device if it's medically necessary. We would consider an augmented communication device to be assistive technology under the CSW. The CSW would only cover the purchase of assistive technology when it's not already available through state plan services. So, for example, if the augmented communication device was for vocational purposes, then the participant could communicate basic needs like using gestures. It might not be considered medically necessary under the state plan, and that's when it would get covered by the CSW. And then for specialized medical equipment and supplies, those can be covered by the state plan when they're necessary and reasonable for treatment of an illness or injury, or to improve the functioning of a malformed body part. The CSW would cover specialized medical equipment and supplies once state plan or EPSDT allowances are exhausted. In the CSW, specialized medical equipment and supplies are also subject to that $10,000 lifetime cap that was established by the legislature. Next slide. All right, so this is my last slide. This covers the ongoing monitoring services proposed for the CSW: personal emergency response system and installation, medication reminder services, home telehealth, and remote support services. Those are not typically available through state plan services, and the CSW would cover those if they were specified in the participant's service plan. I do want to add a reminder that home telehealth is limited only to individuals with multiple hospitalizations or ER visits. or those who are transitioning out of a nursing home. This service is really about offering ongoing vital sign and symptom monitoring and education to help a participant better manage the disease that is causing their multiple trips to the hospital. Okay, next slide. I think we can open it up to questions now. So feel free to raise your hand or put it in the Q&A, and I'll ask Peter to help read out those questions.
No problem. Thank you, Jackie. We have at least one right now in the Q&A, so we'll start there. And as Jackie said, feel free to add any in the Q&A or raise your hand as appropriate. So first question, Jackie, this is probably most appropriate for you. This is a question from Michelle Hill. So Jackie, as Michelle suggests, you indicated that if a person chooses working healthy, that they maintain their waiver spot. Will it have any effect on the wait list? Presumably, you know, their position on it, I would guess.
My understanding is that they can say that you're on working healthy, but your needs change and you no longer can be served through working healthy. You need some additional supports that you then could move on to the waiver and maintain your waiver spot. But Michelle, am I saying that accurately, or do you have anything else to add?
Jackie, yeah, so if you're on the waiver and you move to the work program or working healthy, you can come back on to the waiver. So there's a smooth transition between the waiver and working healthy.
Thank you, everybody. Michelle, looks like Michelle, the questioner, not Michelle from KDADS. Looks like from your comments, we captured what you're looking for, but if not, please just add another one and we'll be happy to elaborate. Another question from an anonymous attendee. Jackie, if someone goes on to working healthy, would they lose their TCM?
I don't believe so, but Michelle from KDAD, can you confirm?
I'd have to look into that. I think that is tied to being on the IDD waiver, one of the IDD waivers, but I'd have to go back and check on that.
So anonymous attendee, I'm sorry we couldn't give you a more definitive answer just based on what we know now. We tried our best. But if you'd like to reach out to us through the website, we have some help emails there. We'll make sure you get an answer with a little bit more specificity once we can look into it a little bit more closely. So that exhausts our open questions for now. We do still have a few more minutes devoted to the question and answer period. So again, you can either raise your hand or add it to the Q&A, and we'll get through as many as we can before it's time to wrap up. While we're waiting, I will just make my usual plugs. We've posted the URL to the website, kansascsw.com, in the Q&A a couple of times. We encourage everybody to visit that to learn more about the CSW, and perhaps especially to provide us with some additional feedback. So on that website, you can find list of proposed services, previous town halls, really any and all updates related to the CSW. And you can join our mailing list. I imagine most of you are already part of it, but if not, that's the best way to get consistent updates on the CSW. And while I've been talking, we've gotten a few more questions. So this one's from Steve Houghton. Has there been consideration for nutritional support? Jackie, I mean, you're probably most familiar with the services. Can you think of any that would apply as part of nutritional support?
I don't think so, Steve. I don't think that's part of our current proposed services, but your feedback is well taken and we can take that back and discuss it further. Thank you.
Most definitely. And Steve, if you have more to add to that, you know, like I said, as always, we appreciate that and would love to get it through our formal feedback form. Another question from an anonymous attendee on the work program. Oh, well, this is a comment from the anonymous attendee. We'll have to fact check this, but thank you, anonymous attendee. I assume this is a statement, not a question. On the work program, they lose their TCM, but they do receive independent living counseling, which is a similar service. So, Jackie, I don't know if you know if that's true or not offhand. We will certainly look into it, but anonymous attendee, we appreciate you adding that information. Hopefully, it helps some of our other attendees. Jackie.
Yeah, I am not an expert on the working healthy, so we'll have to go back and confirm that, but thank you for providing that answer.
Most definitely. Lisa, I think we got about 2 minutes left. At this point, I will throw things to you in just a moment, but I will just say if any questions come up later, you have things we didn't get to, please do send them through the website and we will make sure you get a prompt response. So Lisa, if you'd like to wrap up now.
Great. Thanks, Peter. Thanks, everybody, for their wonderful questions and for attending today. So the next steps that if you would like to participate in the rate study, we welcome all providers, encourage your participation so we can create the best rates possible. And if you have feedback on what we discussed today as far as the quality improvement strategy, please provide specific feedback for us. That's what we mean when we say constructive. So if there's something specific, a word or something we're missing, just tell us what to include and we will look into it. We've discussed this a few times today, so please continue to attend our town halls. We also have our technical advisory group, or the TAG, that we process information through them as well. And then we have feedback forms and then the upcoming public comment period, which will happen at some point during this year, probably later this year. So thank you to everyone for attending. Thank you very much to our interpreters for helping us out today. And our next town hall will be February 19th. So we look forward to seeing you all then.